that's basically it. If you have questions.
Yeah, I'll start a question. All right, so at first I was a little confused because I was thinking of more major medical offices who have their own EMR and EHR scheduling software. But this is really centered in on the home professional care, people that go out and do aftercare, somebody comes out of outpatient.
Yeah, they
need
get out
physical
outpatient,
therapy, or they need some sort of.
Usually, they get out of rehab centers, hospital-based. They come in. They're going to need a physical therapist or a nurse to come in after a knee replacement, hip replacement. You get a lot of cardiac patients after open heart surgery. So, you know, we have to.
How do those people schedule right now? What is different about what you're doing? So,
phone call, simple phone call.
So they're just given a list of providers, and maybe you're on their medical care and that kind of thing. And
Well,
so
doctors know the agency, they
them.
refer out to you, they send the fax. So the initial process of getting it going is not going to change. What will change is once they're on board and they're choosing you as an agency, this is, we're creating this to separate us with our home health care agency. And then if others would like to utilize it, we're going to beta test it later this winter and next spring. Giving our patients the ability to communicate through this web portal. So it's not going to change the process of getting the referrals from doctors. That's the same. It's just once the patients are on board, it's giving them kind of more control in their fingertips, or their family members, because some patients don't know how to use a smartphone effectively. But their family members, especially if they're living far away, it helps out, because if they're living in New Jersey but their loved one's down here, I would use them as a point, and they can get an update of when we're coming. You know, they say, oh wow, the therapist is there today. Or when I leave, I can send a quick message. She did really well. Just giving them some feedback through an instant text or email that's secure, letting them know. So this doesn't really affect doctors, except we are building it so doctors can put in their NPI in the future and check off on orders and look at stuff, which is, this is going to be a 3-phase application. First phase is scheduling. The second phase is going to be a home exercise plan snapshot, which will allow us to custom make home exercise plans with actual pictures of the patient doing the exercise program, whatever it is from a therapeutic standpoint, and then putting it into a framework that if they like, you know, fishing or football or baseball, it could be modeled for something that they want to look at and see, anything to get them engaged in their healthcare and wanting to do what they need to do. We're looking to not only separate what we do, but change the way home healthcare is delivered in the future.
So just one follow-up.
Yeah.
So the business model then is to sell this as an SAS or software as a service model, recurring revenue on a hosted software to other home care agencies.
Right now, yeah, exactly. Where it's web-based, it's going to be web-based. We could do a mobile app in the future, but I've been instructed by a lot of people in the industry, start with a web-based application, make that work really well. Define it so you have your client base and market target, target market. So then we could do a mobile app in the future, though.
Is this something that would work for, say, if there were a patient advocate?
Right.
That they could enroll in this or whatever and sign up and keep an eye on their clients?
Yes, exactly. A patient advocate, so you're like a social worker in the area, or maybe someone who kind of helps them get the right health care involved?
Well, I know they've had a presentation here for a patient advocate, make sure that everything's coordinated and being done that's supposed to be done.
Exactly. Yes, this could be, but the patient themselves needs to consent who can receive information, so they've got to approve. When we have HIPAA-compliant standards, there's going to be strict rules and guidelines on that. Because not anybody can get, it's just, right now it's just going to be scheduling information, not so much healthcare information, but as we move forward with this application, there will be the ability to post healthcare information through this portal where doctors or family members can access it. But right now it's strictly going to be scheduling based. We're going to make it efficient with scheduling. Same thing as we're doing now, except we're trying to be transparent with what we're doing. Right now it's all, we're going to be there at 10 o'clock and I'm running behind, I'll be there at 11 today. So that won't change. Delays are going to happen, but this will hopefully give it more feedback quicker.
Does this connect into what's already out there, or is it standalone by itself?
Well, as far as home health care goes, there is nothing, zero out there that does this. Now there are, I do know there is plans in the works that other people in the country right now are working on similar things. I went through 2 different attorneys where I wanted them to take this case to get a patent for it, and one in Richmond said, Matt, I can't take it, wish I could, but you know what, I got somebody right now with almost very similar system that is on my desk, and we're looking to get a patent for it. But the difference is, he said, it's not the same. He says it's too similar for me to take it. So it's a conflict of interest. And I said, that's great. And I talked to another attorney, and he said, I'll take it, because he's like, I'm looking at the scope of what you want to do. And he says, well, we have Uber and we have Lyft. Both are pretty successful. But he says, this doesn't exist, but yes, you're onto something. We are onto something. And we're going to, our goal is to perfect it and get it out in the patient population fast, as soon as we can, so our patients can begin using it. So.
Are you gonna have some training involved in that? Because what I've seen from home healthcare, you're right, it's pretty archaic. It's paper and phone, and those people aren't real sharp that work there when it comes to technology. So you're gonna train some of them.
Most definitely. Right now, we do all of our documentation in home health through, there's a lot of software-based systems, and the one we use right now is Access. It's just we purchased a monthly plan. So that's not gonna be so much what we're doing here. This is more scheduling-based, information-based. But yes, everything is gonna be done through tablets and devices. But this is the last piece that's gonna tie everything together with helping family and patients be in the know of like when we're coming. Just give updates as far as your therapist is leaving their last clinician's house now. You expect them in this amount of time. Or if we're running behind, give them an option to just hit a button. So if you're driving, you don't have to worry about trying to text and drive, make a frantic phone call. People, you don't have to do that. You can get out of your car, make a call, let somebody know. But it's not going to change that. It's just going to make it easier to communicate. And I think people, as we move into the future, they're going to rely more on word messages, whether it's updates through email. Talking is great. If you're going to be really late, it's good to give a call, for sure. But if it's going to be 15, 20, 30 minutes late, a message may be sufficient for that.
Could you run through the private practitioner's use of this? Like a local doctor, he's got his own private practice.
Right.
He comes to you and says, I want to use this. Then how does he implement it and get it to his people?
What he's going to have to do once we have that set up, we're going to have to use doctors' MPI numbers. So they'll have to use their MPI number to log in. If they're PICOs, they need to be on PICOs, which is a medical accreditation website that doctors have to be accredited to be part of. And once they're on there, they could have access to their patient's information, but they're going to have to prove it's patient of theirs, so they have to put in identifiable data that they would only know as a healthcare provider. So if they want to get another one of their practitioners in their clinic involved, like a PA, they would just give them access as well using their NPI number. So it's all going to be NPI number based. That's when doctors can get into it. That'll be the last phase of this. I wouldn't expect that last phase to probably be out until later 2018, or if not, maybe 2019. I want to make the first phase clearly is a scheduling application. But what's separating this whole web portal is the fact it's going to be a one-stop shop in the future, and for a lot of information.
So does the patient use this?
Patient's going to be using it to check their schedules. Family members can check their schedules as far as when visits are occurring with whom, like so they know what therapist or clinician. And also eventually patient data and information, like if we have a balance program, this sheet with standardized tests could be transposed onto the app where they click and it'll say, test data on this particular patient. They could look at it. It may not make sense to some patients, but the doctors will make sense. And if patients want to find out more about it, obviously when we come, we can explain, what these tests mean. We do it right now, though. We take the data down and leave this in their folder in the home. So we're looking to make that transition as we move into the future. The packets and folders are going to be less and less common, and we're going to be transitioning more towards the web application of people. That's going to be what we're depending on. And we're not there yet, but 15 years from now, 20 years from now for sure, I can guarantee you we will be.
Well, how does the patient get it though? I mean, what the doctor says to the patient?
How does the patient get what?
This.
The application.
It's going to be a link through a website. It's going to be a link through our website. So all they have to do is go on through our website. You have to have internet access. If you don't have internet access, obviously somebody in the family should. But if not, that'll be a major issue. But I would think that internet access to be able to use the internet in the future. I mean, that's going to be, I would think, be pretty mainstream, everywhere.
I think it is a web portal. So basically, you
probably get a code like your social security or
You
any
log in,
patient number. You log in and
go to
then
your
It's gonna be
page.
their medical record number to log in,
Yeah.
but it's a
Yeah.
web portal, so basically it's gonna be linked in through our website. To make it easier for them, they just go there and says, go access web portal here. So we would need to instruct the family. Some patients now could do it, but there's obviously some that it's foreign to them. Whenever they see something on a phone or tablet, they get confused. Just meet people where they're at, basically. There's 3 back there. Let's take the gentleman in the white shirt.
Did you say that the OT and the PT can use this to get directions and routing to the patient's home?
Yeah, PT, that's gonna be, right now I can do the same with entering it on my phone, but this will be through the web application. So we would hit map and directions here, and it would say, the patient's name is, it's an example, Paulina Cruz, map and directions, but it gives you their exact address. And this, when you hit this button, it'll take you through Google Maps.
Okay, related question, I know a couple of folks who do that kind of work. You might think about at some point adding in a capability to list animals and pets in the home so they're not chasing them around the neighborhood, which happens a lot.
Listing animals that may,
In the
like,
patient's home.
in the patient's home, yeah.
And the cat gets away and the dog gets away. The
Gotcha.
provider.
Our software allows us to do that, but this will even be another way to do that. Give updates and like, don't go to the front door. If there's a really mean dog at the front, you go around that, you know?
Yeah, important.
So, will you have push notification, I guess, to confirm appointments the day before or an hour before, you know, hey, that type of stuff that will let, I guess, the physician or whoever's coming out know that,
Yes.
hey, we're still tracking.
Right when we get to, well, that's the beginning. The push notifications will come after on when, right here, okay, so start route. The one slide I didn't get up there, which is actually in my binder, because there's actually 22 slides to convey the application, but being this is only a 6 to 10 minute presentation, it was gonna be hard for me to go through all 20 slides. But after you hit that button, push notifications will pop up and give you options. Are you gonna be 15 minutes late, 30 minutes late, or an hour late? Also, another push notification will pop up and say to the expected time of arrival based on traffic is this, and it'll send an update to whoever is gonna get information for that loved one. It could be the patient themselves, or it could be their granddaughter or daughter, family member. So they have an idea, okay, they're arriving now, and if we're getting held up, it'll take the therapist, it'll pop up on their phone or their tablet, and it'll say, are you still on time? It'll ask you a question.
So I guess I meant more in the terms of, you know how, so if I set up an appointment, I can say, hey, remind me the day before that I have an appointment tomorrow. So will I get something on here that says, hey, you've got John Clark,
Yes.
you know, PT coming tomorrow at 9 a.m. So I can, oh yeah, that's right.
Push notifications is gonna be sent out 24 hours prior.
Okay.
We can also do it, the developer said we can do it in stages, 24 hours, we can do it the day of, you know, and anything that'll help. We can tailor it to the patient's needs. Some patients or family members just give me a warning the day before, or just do it the day of, so. This,
So you're in the home health care, your company?
yes.
You do this right now?
Yes, ma'am.
Okay, and are you implementing this application in your company?
We will be.
But you
Because it's
haven't
not-
yet?
Well, because it's in the development stage.
Okay. Okay.
It's being developed now, so, our developer is in the early stages, it's gonna take 5 months to do it, to get it fully, and then we're gonna beta test it. So when we do beta test it, it's gonna probably be December or maybe January, where I'm gonna offer it to patients. They're gonna sign a waiver stating that, this is going to be HIPAA compliant, but there's a difference between HIPAA compliant and HIPAA certified. So they're gonna say, I understand that this application is not HIPAA certified. I am waiving my right to this, this, and this, and this. But all your information that you give me will be kept in a secure database. It's only gonna be shared amongst healthcare professionals and loved ones and family members. So when we do get this HIPAA compliant, that's a whole nother. That's about $75,000 down the road.
So you're gonna try this with your agency first and see how it goes, and then you wanna look for other home health care agencies to join in and,
Exactly.
Okay.
Not to mention, there's DME companies I've already know in the area that if this is in front of enough patients where they're family members where they like using it, they feel it gives them transparency or it's more interactive in the home health care, where they feel like they're part of the scheduling process, or they feel like they're attached to the agency in a good way, then they're gonna wanna put they might wanna advertise on the web app for DME equipment and they would be willing to pay to put their banner on there, so there's another revenue stream for it. I'm sorry, ma'am, I missed you last time.
That's okay. So you have your own home health agency?
Yes, ma'am.
Right, okay. There are so many home health agencies out there, but I really see the value. I used to work in the field back in the 80s, and it was all paper and phone calls, and this is very valuable. Have you approached any of the other agencies?
Other home health, actually, I'm not really talking to too many other agencies about it, to be honest with you, because it's neat. It's one of those things where it's just, there's other clinicians I know that work in the agency that agree they think it's going to be very useful. But when you talk to higher directors, especially people that have been in the business a while, they don't really shoot you down. They're like, any extra expenses and software, they're just like, you know what, it's hard enough to make money in what we're doing right now. Why are we going to be doing that? I'm like, but I think that's a poor way to look at things, because I'm looking at this as an X factor, as where it's going to go anyway. So we might as well invest in something that it's going to go there. When patients and family members do expect that, which they will, we're going to have a way to do it and then deliver that service. So when they talk about profitability, I say, once we get, I don't know how much somebody would pay for something like this in the future, but it'll be dictated by, I guess, like Snapchat and other apps that have gotten out there. Started out just taking a picture and sending it to somebody who thought that would have taken hold. Well, I don't know what the market's going to be like. It might grow fast, it might grow slow, but that's to be dictated by people who want to use it and the advertisers.
All right, you said you're not the only one doing this. So what is going to set you apart from all of the other people that are doing this?
Well, I don't know who else is. I do know that there's definitely some other people in America today that are trying to develop something in home health like what we're doing. What's going to set us apart is, I don't know what their line of thinking is, but I'm looking to create more of a one-stop shop. Maybe someone's going to come up with just a scheduling app that's going to be just strictly scheduling, which is great. They'll have their niche. But I'm looking to make it more interactive between not only family members, doctors' input, and also home exercise plan. The home exercise plan part is key, because I'd like to give patients a way we can email them the exercise plan rather than giving them handout picture of stuff with an actual picture of them, because sometimes it's even more motivating to see a picture of yourself doing an exercise properly, and it may give you that extra inspiration over the next 6 to 12 months to stay on target with doing your program, which makes a world of difference. I've had patients quit doing what I've told them to do a month after I'm out, done working with them, and if I can convince them to do another 12 months, it might create some type of good carryover where it's a life habit, which is what I'm trying to create.
Would this also integrate with your back office billing?
Good question. Yes, eventually there is a method to the madness here, so to speak, because we already have software programs for documentation. There's already companies out there that do that. Eventually someday I'd like to get involved into that arena and deliver a better product as far as documentation services. But for billing purposes, we can make it so the clinician has a visit. In home health, a PT evaluation is worth 1.5 points, just a regular follow-up visit is worth 1 point, and a start of care, a brand new admission, takes longer because you're gathering a lot of data from the hospital, wherever setting they were previously. So that's 2 points, or in some cases 2.550 points. Those are all attached to billing codes of what Medicare reimburses and other insurances. So we can calculate based on what we're scheduling, and this system can just calculate at the end of the week, this person produced this many points, and you can see how many points they're producing, how much revenue it can create based on the insurance you're billing, because it all changes. If I'm billing CareCentrix, we're going to get less money back than if I'm billing Medicare. If I'm billing Blue Cross Blue Shield, I'll probably get a little more than CareCentrix, but maybe not as much as Aetna. If I'm billing Medicaid, it varies. Medicare is the gold standard, though. Just want to let everyone know. Medicare, if you can run a business on Medicare, well, that's what basically we're doing right now. Our census is right around 30 patients, but Medicare, if you can develop a strong Medicare base, it's the government, and the government pays. But the government also has the strictest standards, so we have to be ACHC certified, and that's what, when we get this application going, it's going to have to be going through rigorous Medicare standards, because if they're going to back it, and when they do, it's going to be allow us to bill more efficiently, for sure.
Well, I was just thinking, I have never had home care, or I don't know anybody that had home care. But in the next stage, can you have it in a way that your actually tablet becomes the healthcare provider? So basically, instead of you going,
Right.
can they just put the video in front of them? I mean, like you go train them first what to do, and then you can view like 10 people at the same time. They do certain times, they do their training. You know, if they have to sit up on a chair or something like that, you view it on their tablet.
It's like a video. It's
Yeah,
just-
and then
yeah.
communicate with them. I don't know if it's doable.
With some patients, that could be an option. Nothing's gonna replace in the home healthcare arena, the human interaction between a nurse, a speech therapist, or an OT coming out to give the professional guidance one-on-one. So as healthcare and technology advances, there's gonna be different ways that we can educate and disseminate healthcare processes. Doctors are still gonna be the doctors that do the surgery. However, what is changing, and the surgeries are gonna be, their robots are doing better and better at performing incisions and different internal types of surgery, whereas doctors are getting the equipment and setting it up properly. And that is changing. What doesn't change is, though, you can't have a robot come in to see a patient and the human touch of being able to stretch somebody properly, to instruct them about proper positioning. So in home health care, there is gonna be, maybe this is part of it, you have the way it's delivered, the way it's scheduled, and that's our goal, to change the way delivery of home health is done into the future. But we're never gonna be replaced by artificial intelligence, as far as that.
Not artificial intelligence, but you know, like you go stretch them and all that stuff, but they have to do certain exercises every so many days, right?
Right, yeah.
So, I mean, do you have to be there for every time they do that, or can you just
No.
view it on
However,
the video?
they can maintain their exercise program, videos, that's the snapshot application to give them pictures of what they're doing. That's great, but we still need to follow up 2 or 3 times a week, depending on what the doctor wants for the frequency.
Okay.
Because there needs to be the skilled intervention from a licensed therapist or nurse to make sure they're doing good.
Correct.
Hold on one second. All right. Yeah, I saw you.
You say you're gonna do an app. Have you researched the apps out there that do this?
Yes, I've already looked. There's basic scheduling apps that already exist. For basic, it is just it's not tailored to home health. It's just a scheduling app where patients can log on and they can get a quick update or whatever. But this is going to be tailored for home health care within that 2-hour interval that we're talking about, and the push notifications are going to be tailored to what I think Julian was questioning, because the push notifications are key in alerting. Home health, the dynamics change because we've got patients in locations. So on Monday, my schedule for Thursday may be one thing, but then as I get to Tuesday or Wednesday, it's totally different. Because I got a new patient out of the hospital, he lives in Suffolk. I have 5 patients in Virginia Beach. I gotta change my method, what's gonna work for me to be smart about traveling that day. As long as the patient's okay, I can let them know. Oftentimes, if they don't want that time, we can get another therapist to maybe get out there. But this is the reason for the application, is to send quick updates.
I mean, have you gone to the App Store and
Yes.
gone through the list?
Yeah, there's
And
quite a
this is
few.
different than what's in there now?
Oh, totally, because those are not, those are just scheduling, they're just basic scheduling apps. They don't take into consideration the nuances and the rigors of home health care. So basically, I've told our developer, these are the issues and things that we run into, and these are what we're gonna have to have in this application to allow transparency or give faster feedback for patients and allow them to communicate. The apps out there right now, they don't allow for, it's not a secure web portal, number one. It's just an app.
Yeah,
So we're creating a secure HIPAA-compliant web portal for someone to send me a message about, today the visit didn't go so well with so-and-so. Afterwards, they complained of a lot of pain in their left hip. Thanks for letting me know. I'll let the doctor know. I mean, now the way we do that is they call later if it's that bad, or they don't call at all. They wait till the next visit. But what this will do is it'll allow us to get messages, and eventually our office is going to have to go through the messages from clients and have somebody probably just works in the realm of deciphering the information coming in from patients or their family members. What is important, what isn't, what needs to get back to you right now. And clinicians can take care of it on their own, but we're going to have somebody in the office that kind of sifts through that information.
So what's the, I guess, the price point for this app? Is the cost that's going to be incurred by the physicians or by the clients, or?
It will not be by the client. I'm looking at having it paid I want to develop patients that find use and they want to use it. And it's going to be the home health company would need to purchase access to use the web-based software on a monthly basis, or if they would like to purchase the license, you know, or the application code, that would be a whole another, you know, negotiation or possibility. Because if they do that, they could potentially take our application and they could add nuances to it and create their own, you know, if they wanted to. I mean, but there's gonna be a big price for that, because I know what I'm gonna have to pay to get this going.
Yeah.
So it would be easier for other companies to say, yeah, I'd rent it for $99 a month, maybe $150 a month. And then depending on their patient population that's using it, it can go up depending on, you know, if they have 50 patients on census, you start from 0 to 50 at $99 a month. Now, if they have 100 on census, maybe we could do $200 a month, because it's going to be having more and more patients using it, which should be increasing their profitability, because the idea is that patients are going to want to use this as an intangible in the future to communicate. It's going to separate the home health company that doesn't have it. And I'm not knocking the ones that don't want to use it. You can still deliver excellent home health care. But like I said, I know where we're going. I talk to a lot of, I'm in the millennial generation. I understand that you have the communication, ways to communicate are changing, and they already have. And some people may like that, some people may not. But I know where it's going, and I figure we just have to meet people's needs where they're at.
So I think their business model is go after the agencies. I don't think you have a chance at the customers.
No, it's
You have
always
way too much
agencies to buy.
competition.
That's what's going to happen. I already.
And Centera and those guys are working on technology where, you know, mobile doctors, so you already have their scheduling. You're really an efficiency model for home health care. I mean, so you need the agencies as quick as possible. As far as patenting, I mean, I have no idea what your guy is selling you on. You're not gonna protect this. I mean, it's a scheduling app. I mean, Uber's not protected from Lyft, Lyft's not protected from this one.
Right.
I mean, it's very hard to protect software. Patent attorneys get paid for, well, writing patents. You have to protect your patent, you'll never protect this patent.
For the entire scope of the patent, as far as what Centera has, I've already looked at the scope of their software. It doesn't do anything that this thing will be able to do right now.
I'm
Now
just saying Centera as a general company.
Right.
I mean, I'm involved in a group that a buddy of mine sold 5 healthcare companies 2 years ago. We looked at developing apps, and we were in the market of developing an app for going into doctors' offices and stuff, where more of mental health deals and HIPAA and all that stuff.
Right.
With Obamacare, you can't get anybody to sign up in the doctor's office on any long-term leases.
Right.
Because they're scared as shit of what's gonna happen and being stuck to a long-term lease.
Right, I've heard that.
But your app is working for the agencies, it's not gonna work for the customers. Your customers are gonna get
No.
by doctors.
The customers are not going to be paying anything. This is tailored to agencies wanting, home health agencies particularly, wanting to streamline their efficiency of the way not only the care is delivered, but the transparency of communication between certain family members. Phone calls still may apply, emails may still apply, but this just gives them a secure way to do that. And you know, Centera's a big hospital. Any big hospitals are always going to have. It's like the big elephant in the room, you know. I'm not going to get off on a soapbox here, but I don't know how they're not considered a monopoly, to be honest with you, because they have their own insurance company, and they, when asked to partner with that insurance, they have said, you know, we'd love to, but Centera wouldn't approve. And to me, that's not really. I mean, it's like, because they own it, and I just think that it needs to be more of a level playing field there. I know hospitals are important to communities, and Medicare views hospitals as a needed thing, but they are putting more and more money into home health because it costs a lot less to have a home health care professional provide health care in the home, keep the patient safely in their home so they can stay out of the hospital, because once a patient gets to the hospital, you're looking at 1 day stay of $2 to $3 grand. $2 to $3 grand for 1 day. For home health care, one visit, $200 or $250 a visit max to supply antibiotic intravenous medications. We can do home infusions. We can do, I mean, basically anything you can do in a hospital except for surgery. But it can be conducted in the home as long as the patient does not have life-threatening type needs at the time. There's care that can be delivered in the home. And most baby boomers today would love to have the option, I should say baby boomers, anybody in their right mind, if you ask them, would you rather be in a hospital setting or a home health setting or at home, they would say, I'd rather be home. I mean, who wants to stay in a hospital for weeks on end, or even a rehab center? They're needed, but we're just trying to deliver better and better care in the home, because in the future, that is the wave of the future as far as the healthcare environment. There's gonna be better and better healthcare delivered in the comfort of your home, and baby boomers are gonna want access to information quick, fast, and they're gonna know, they're gonna be very demanding.
Are you storing all this data? Like that you're hosting all the data now?
Right now, the app's not even, it's not even.
Oh, you haven't developed this yet?
No, it's in the development process.
Gotcha.
These are prototypes. So once it is out there, we'll be beta testing it, and I'd love to include everybody on maybe some of those prototypes.
Yeah, are you, I mean, it sounds like you have skilled you have OTs and PTs.
Yep.
Are you looking at mainly, for the agencies you're dealing with, mainly having skilled nurses, or are you looking at the CNAs and the PAs as well, the unskilled,
Yes.
home health care companies?
We offer the CNAs.
I mean, are you gonna have like a menu for all that when you do it? Or are you gonna tailor it to those different agencies?
Yes, it can be tailored to different agencies for sure. Like in this case, you see at the top, we have the PT in purple, OT in the yellow, skilled nursing. That's really a pink color, even though it shows up purple here. Home health aid in blue. Speech therapy is green, and social work is like an orange. So if we had a personal care aid, we could do black, or we could do like, you know, maybe an aqua blue, something that stands out. But we can add as many disciplines as we need to whatever the agency has. For ours, because we're home health, we have all the skill disciplines, but we also offer personal care aid and the home health aid too.
So your target market is great, makes a lot of sense, but I wonder if you could expand your opportunity by looking at other healthcare agencies that serve kids or teenagers, you know, people that also do home visits. I have a friend that does it in a mental business.
For like behavioral health
Right.
or something. Oh, yeah, I mean, that's
Yeah.
something I've really thought about. So, yeah, like I said, this is more for home health here, but I'm looking to change the way we deliver maybe healthcare in general, you know? And this, I know Centera, you know, they've got some cool things, but Centera also, people create stuff without having a role. They just want to try to get advanced, but they don't know what they're trying to advance. But I've got ideas because I've been in home health, I know how it works. And I'm really, I mean, I'm sharing with you guys, but the people that don't get it, they're never going to get it in some ways. But I'm going to let the population dictate that, and I'm going to let the people that can use it dictate it. We'll see. The proof will be in the pudding.
So kind of just to dovetail off that, I was going to ask, have you thought about elder care, companion care type of applicability?
Yes, elder care. Yeah, that's another medium that's going to be used as well. Elder care, companion care. We do the personal care, but companion care can run in 12 to 24-hour shifts usually for patients that have like hospice type needs, you know, or a lot of medical needs at home. All right.
Well, you're saying this is a scheduler, but would it also be that the patients, maybe the doctors, actually choose providers through the app, through the platform?
Can the doctors choose? Can they choose providers through this platform?
Mm-hmm.
I guess in the future, if you have a lot of doctors that eventually register through the portal, that like using it to check off on orders, it's going to be one of those convenience things. Some doctors would rather just get a fax. Now, right now, I've got some doctors maybe a little older that like to just get faxes. You ask them to sign up through Mercury Doc, which is more of a Centera medical field type system. Mercury Doc is really outdated right now. I mean, it's a good system, but it's been around for about 15 years. So yeah, if doctors were using this regularly and it's more mainstream, they could, patients could maybe find a way, we could have a search engine through it to find different practitioners close to them.
To lead this further down the road.
That's down the road.
If that would be the case, you all of a sudden you have actually providers competing on your platform for doctors and for patients.
Exactly. So I guess what I'm saying, this is, people say it's scheduling app. I'm using this as a starting point to change the way we deliver home health. But I'm also using it as a starting point of where we can progress with delivering in healthcare in general. And I don't want to get too far down the road, but I do see a lot of potential, like with what you're saying there. Having doctors log on and be able to check on patients, sign off on orders, being a one-stop shop, and then just the ease of accessibility. It's going to take a lot because I've already known what it takes to get this going. But if the need is there for it, and advertisers and it's getting in front of people, getting it built properly is not gonna be a problem. You know, you just have to have a need for it. Because it's a lot of money to develop this stuff, but you have to have the need though, so.
I see a potential where you could kind of white label this. It's a scheduler sense, but I mean, dog walkers could use this. House sitters could use this.
Right.
You know, you just take the platform and change the name of it.
You could, yeah, and it's interactive, so the other scheduling apps aren't quite as interactive, but with this patent, the attorney, what he saw is, he saw a bigger scope of where it could lead. And in a court of law, yes, if somebody is doing the exact same thing I'm doing, okay, and the dates, I have immaculate documentation is when I first started the process, and all of a sudden, you know, well after I've got this thing going, it's eerily similar. We're the same in a lot of respects. And it's somebody that I may have come in contact with. That's where the patent helps you, because it's a patent, it's in your name, it's your right to pursue, to grow it. And every person that gets in the way of that has taken it, if you prove that they're incorrect, it just gives you more of a lane to continue to move forward. It's kind of like with Facebook. Facebook started as an idea, but there was a bunch of people that claimed it was really my idea, and Mark Zuckerberg just kind of parlayed that off into his, but where's my share? So, but that's where you have a patent, that's where you have to have attorneys, and that's what, I've already got some really good ones that are, some people may say you waste your money on that. I don't think so. When you have something you believe in, I think that it's important to have a good legal team of people that can actually represent you properly in the court of law to prove that this is your idea, and that's the only way you're going to make it move forward.
Do you have a provisional patent?
Yes. Yeah, it's already submitted. In fact, I have it here if you guys want to look at it. It's actually the one that I have is should be right here. Go ahead. Yep.
Yeah, just wanted to get short of time. One thing, just on the advice thing, you've done a great job today, and obviously know your subject matter really well, but a couple things that just listening as you grow, because I know you're in early stages, I was a little concerned when you said that there was some resistance in your field, okay, to the app. So I think you need to kind of research that and define it a little more, and also I would say that...
Well, no, we're just seeing resistance.
And also the pricing point of it.
Right.
You really need to understand, I think, your pricing, because you really need to kind of build a business model or a business plan, you know. I don't know what stage you're in, you answered a lot of questions today, but those kinds of things I think are really important for you to really define, not only the technology, which has to work, but also the other side
model part of it. Because I've talked to a few people that have done some other web apps, or they're giving me ideas of how this could really generate income. Once you have a viable app out there, patients are using it, you have agencies that want to use it. And I didn't want to mislead you by saying resistance. I've had some agencies, directors say that this is really useful, let me know when it's going, I think we could use it. But I've also had some other ones that are, in life you're going to get, like I said, there's always people that are going to poo-poo.
When you're business planning now, you need to take that information and say, okay, how do I overcome this, okay?
But I need to take
some people will never, some people will never buy your product. And that's okay, because you're not going to get the whole pie.
Exactly.
But you need to, it's always good as business people to listen and say, maybe because this person won't buy it because of this, then I need to address that, and maybe I need to educate people that it's better than they thought, or it actually helps them out, or it benefits them, and so in some ways that they wouldn't have that objection. So you kind of overcome that by just listening to what people say. Some of it you can overcome by educating your customers, and by focusing on how you sell it, so that it kind of addresses some of those issues before they come up. So they don't just say, oh, I don't need it because blank, because you've already told them that they need it because blank.
Yes.
So it's just the part that, listening, as you're in the early stages, is really just advice as you're going forward, to remember that it's okay for people to say no, because then you know what you need to pay attention to.
No is the beginning of yes. Down the road. And you're talking to somebody that's, I'm pretty committed to what I do, but also, in the face of adversity, whenever you do get that, you're all getting ready to succeed when you get a lot of resistance. I like resistance. Resistance is a good thing.
So your final question is, what can 1 million cups do for you?
What can 1 million cups do for me? You guys have done everything just by having me do this for the first time. This is amazing, yeah.
Oh, you're good, you're good.
I mean, this is, you guys just being able to have me here so quickly too, because I just submitted the form a week or two ago.
Do you have a slide you can put up with your contact info?
Sure, I think that, it should be on the bottom of the actual, I have business cards I can give you as well, but it should be on the bottom, right here, contact info.
Yeah, it's not visible.
Unless you got a telescope, that ain't gonna help.
Yeah.
We need to work on the 10, 20, 30.
I do have this is for our home health company, so. They're different though, different entities. Equilibria Home Health is home health care, Home Health Interactive Technologies is the company for our web-based technology.
Matt, thanks so much, and here's
Thank you.
another million.